Good morning, everyone, and thank you for waking up with me on Up with India. Today, I will be joined by Metropolitan Wilmington Urban League community organizer Shané Darby and the founder, who's also the founder of Black Mothers in Power Advocacy Campaign. Black Mothers in Power, the campaign to improve Black maternal health, was started to reduce the mortality rate of Black mothers and babies and to improve the health of Black mothers and babies. This statewide campaign has called on the attention of many people around the state of Delaware. And I like to say it doesn't matter what month it is for advocacy, it's always an important conversation to have. So I'm very happy to have her on the show. Thank you so much, Shané, for joining me.
Yes. Hello, everyone. As you said, my name's Shané Darby. I'm happy to be here to start this conversation with you guys.
Oh, for sure. And we are going to get into it. You know, this is a conversation that I think is now coming to the forefront, especially in the media. Over the summer, I don't know if you were, I'm sure you were paying attention just because of the organization, but there were so many young mothers that we were seeing that were dying. We were seeing babies, these stories really surfacing. And I think it really brought it to the attention of a lot of people to kind of start doing their own research. And as I was just looking into your organization, and I mean, just some of the facts that were, already just thrown at you as soon as you start kind of reading into Black Mothers in Power, the mortality rate for Black infants in the city of Wilmington, more than 3 times that of white babies from Delaware. You go on to say Black and Native American women are 2 to 3 times more likely to die from pregnancy-related causes than white women, according to the Center for Disease Control and Prevention. This is such a heavy yet important topic, Shané, but tell me, why did this even come across your desk, and why was this something that you wanted to be passionate and advocate for?
Right. So my why really comes out of, that was my daughter. My why really comes out of becoming a parent. So I got pregnant my senior year of high school. I had my first daughter. She's about to be 13. So 13 years ago, I had my first daughter. I was on my way to college, and I literally knew nothing about pregnancy. No one educated me about pregnancy, reproductive rights, what my birthing rights were. I was young. I was kicked out, experienced homelessness, experienced loneliness. So I had all of these experiences, and I really didn't understand what was going on with my body. I didn't know how to advocate for myself. I really didn't understand the importance of breastfeeding, right? I was so cut off from what it meant to parent, what it meant to birth. Those things weren't even a thought to me at all, right? And then I call it my second pregnancy. So I have 3 children in total. So my second time, I had 2 kids pretty much back to back.
Oh, wow.
I was pregnant. So my second pregnancy, I had 2 other children. And in that journey, I wanted to figure out how I can be how can I understand my pregnancy more than I did when I was younger, 5, 6 years ago.
Right.
So that's when I began my journey of reading books, like just finding books, reading about pregnancy, reading about Black women. Social media was like the groups were starting to create. Like they were kind of new 5, 6 years ago, where Facebook started to create like groups of people and groups that you can join. So I'm just on Facebook, I'm looking up groups, and I find groups like Black women who breastfeed, Black women who cloth diaper, Black women who baby wear, Black women birthing natural, things that I never thought of a day in my life.
This was all new to you.
All new to me, right? So I joined these groups, and I'm listening to women who have been advocates and doing this type of work, either as birth workers or just someone who experienced some type of birth trauma, tell their stories. And when they're telling their stories, I'm just listening. I'm taking in the information. I'm doing the suggestions that they said to, like, read this book, read that book. I'm learning what a doula was. I never heard of a doula a day in my life.
We're gonna get into that.
Yeah, what a midwife was. Like, this is like new information to me. So I started adapting that into like what I wanted to do. Like, I wanted to have more control over my birth. I wanted to understand what procedures were happening to me and why it was happening. So I start questioning my doctor, and they were like, "Oh, we never had anybody ask us that." Yeah, right. So, and then I learned, like, you can fire your doctor and get a new doctor. People don't know that. Like, sometimes your doctor does not know the answer. You know your body more than anyone else. So that's when I learned about these statistics, that Black women were 2 to 3 times, and Black babies were 2 to 3 times more likely to die. That's throughout the nation, right? So that's why I'm like, just solely because I'm Black. And what made me even more upset, or this passion, this fire that it gave me, was that it didn't matter if you were a poor Black woman, a well-off Black woman. It didn't matter your social economic status, how much education you had, if you were famous, Serena Williams, if you were Beyonce, or if you were Gabrielle Union. Black women were experiencing at an all-time high health complications and death due to pregnancy.
Why do you think that is, Shané? I mean, when we
Right,
look at these statistics, where exactly are they stemming from?
right.
Historically?
Right. So where is it? Why? Why is this happening? So, what we have a very unique history in America, Black people, right? And we have to understand historical racism, and we have to understand institutional racism and implicit bias that happens in the healthcare system. So the Center of Disease and Control stated that Black women and Black babies are dying at high rates due to implicit bias and racism that we face in the hospital and the healthcare system. Literally, you have like out of this racism, this idea that one group is somehow better than another group, right? And that they have the right to control a group. So in our society, that's white people, right? We have this one group as a collective that somehow believes that they're better. In society, we use institutions to kind of solidify that idea. And the racism in the healthcare system, you'll see that Black people, and specifically Black women, have been forced sterilized throughout history. We have been experimented on. So the practice of gynecology started with Black women who were enslaved in Alabama. They experimented and used Black women. They feel like Black people, even today, you look at the studies and research, when you walk into a hospital, subconsciously, that nurse or doctor is looking at your Black skin, and thoughts are triggering off in their brain. Some of them are negative, some of them are positive when they look at you. And when they see your Black skin, some of the thoughts for some people may be that Black people don't feel as much pain. So when they're telling me they're in pain, they're at a 10, they're lying. Because Black people don't feel pain, or their skin is thicker than white people. So we really have to understand that when we're walking into the healthcare system today, we are facing and battling implicit bias. And then we even have some people who are just blatant out racism, blatant out just racist, who work in the healthcare system. So that's really like working with the healthcare system on designing trainings that address implicit bias, because when you have, all of us suffer from implicit bias, even Black people, right? If I see a group of Black boys beforehand, I've been conditioned by society. If I see a group of Black boys walking down the street in Wilmington, automatically negative thoughts trigger in my head, because society has conditioned me to believe that Black boys are dangerous, right? Especially Black teenage boys. So I have to recondition myself that when I see a group of Black boys walking down the street, they simply could be playing, right? Why automatically am I thinking something negative, right? So we all suffer from implicit bias, even about ourselves as Black people. So, because it's been conditioned in us. So it's really important to understand implicit bias and racism that we face in the healthcare system, and then the history of racism. When we were in slavery, when we were enslaved, they told Black people we weren't allowed to breastfeed. So we had to breastfeed their kids, and we couldn't breastfeed our kids. And when that happened, that cut off the generational knowledge that gets passed down about breastfeeding. So that decreased our numbers on Black women who breastfed by that one action of telling us that we're not allowed to breastfeed our kids. So they cut that off from us. So right now, if you look at the numbers, if Black women were to increase our breastfeeding rates, it would reduce the infant mortality rate by 50%.
Why?
So,
Why is that?
Why? The milk, the nutrients that you get in breast milk helps build your immune system, you and babies. It has some very good like nutrition to help your immune system in your body that no milk can replicate, no formula can replicate. No one can get close to the things that breast milk can do. It's one of the best things that baby can have. And for mom too, breastfeeding is great for mothers too. There's some immunity that gets built up in you too, and some benefits to your body from breastfeeding. So a lot of our children aren't getting those nutrients that they need that come natural from our body to their body that helps with their brain development, right? And that 0 to 3 range, when most kids are breastfed, are so important to the development to you as an adult. I told you I was busy. So it's really important to understand that if we were to increase our breastfeeding rates, the infant mortality rate can be decreased by 50%, they said on the CDC website. So we were cut off from that knowledge 100 years ago. Well, more than 100 years. We're in 2020. So over 100 years ago, we were cut off from that knowledge from 1619, right? Hundreds of years. We've been cut off from that knowledge that affects us today.
Yeah. You know, I ask you these questions because, like you said, when you first started to kind of become exposed to the different groups on social media was when you started learning. And unfortunately, or fortunately, this may be the first time that women who are watching right now may be exposed to a lot of the information that you're sharing, which is extremely vital for life, for the preservation of life itself. I do want to figure out, or I wanted to ask, how exactly do you guys fight against systemic racism and implicit bias? That is something that you talked about in the beginning of the conversation, and I just wanted to know, how are you exactly targeting these healthcare professionals, these institutions that may be plagued with this, implicit bias and systemic racism?
Right. Well, I think it's going to have to be a mixture of collaboration and enforcing them to do stuff. Like, I'm just going to be honest. So the collaboration piece is talking to the OBGYNs, talking to different healthcare professions about what does their training look like for implicit bias and racism? How are they gauging people they're hiring? How do these people feel about Black and brown people, Native American people? Like, having these conversations and making sure it's an ongoing conversation in these hospital settings and even in other healthcare settings. I think anyone who's a doctor of any type of health should be aware of implicit bias and the racism that they hold, because they're going to be dealing with Black people and brown people, right? So I think it's really important to look at the training, look at how they're hiring. It's really hard to even think of tackling systemic racism as a whole. Like, that is overwhelming, but those are some things that we can do. And then I also think with collaborating with them, there are going to be some things that they're just totally against and don't want to do. So we're going to have to force them through legislation. Legislation using policies to kind of mandate that certain things are happening in the state of Delaware.
I did see that you guys supported several legislation efforts to reduce the disparities in maternal and infant health, and the General Assembly passed a resolution earlier this year urging state officials to examine extending Medicaid coverage to 1 year postpartum. So there's a couple different things going on here. Talk to me about some of those legislative pieces that you have been able to support, and do you think that it is enough, or if it's moving Delaware in the right direction as far as targeting this problem?
Right. I feel like it's moving, and I feel like it's moving, but what messed us up, of course, was COVID this year in the state assembly. So we weren't able to push some of the policies that we were interested in to really get a better gauge on if people were going to be like, yay, let's pass these legislations or not. But I think it's really important that the Medicaid extension happened for the postpartum period, because that's called the 4th trimester. So you have the 3 trimesters in pregnancy, and then you have your 4th after you have your baby. That is one of the most delicate times for a mom. All of a sudden, something pops out of you, and you got to take care of it, right? And mentally, physically, your body just went through, no matter how great of a birth you had or terrible it had, it's still some type of trauma and sudden thing that happened to your body. So you need support in that 4th trimester. And postpartum depression amongst Black women is very high, and we're least likely to be tested or not tested for it, but measured to see if we have it, like at our checkups afterwards, at least likely to be treated for it or seek therapy for it. I suffered from postpartum depression after having my second pregnancy, my two I had back to back. And that 1 year for Medicaid coverage for people who are on Medicaid to have those services is so crucial. And I think it's once we have the policy and legislation, it's really more now how do we tear down stigma, especially in the Black community, about seeking services of therapy services and mental health services. Because honestly, I'm gonna be frank, before those two, I didn't suffer from mental health issues. I really thought mental health issues as was like a white people thing. You know, that's like a stereotype or a stigma in the Black community. Like, oh, we don't get crazy. You know, we don't gotta take medicine. That don't happen to us. We don't get diagnosed with that, right? So it's something that's like really not talked about in the Black community. And after experiencing that, I'm like, yo, like we need help. Like we gotta seek therapy. If you need medication, take medication. It's okay. So that is so crucial, and I'm so happy that happened. But now we got to break that stigma within the Black community that it's okay to ask for help and to get help.
It's so important that you brought up postpartum as a mental health illness because honestly, it is. I mean, there's so many different types that we talk about when we talk about mental illnesses, like just regular depression, just, bipolar, schizophrenia, these types of things. But postpartum rolls right into it. And, what's interesting is that oftentimes when we do talk about postpartum depression, it's typically after a woman has given birth. But many women experience that whether they've had a miscarriage or they had an abortion. Can you talk a little bit about that and just how people can navigate and move through those spaces to heal as they are, going through that time and period?
Yeah, I think this would be a perfect segue for me to talk about doulas. So doulas are individuals that provide support to a birthing person through all types of their reproductive journey. So that is, you have doulas who are abortion doulas who helps mom make a decision on if she's going to have her abortion or not. And if she does get an abortion, that doula provides the support, the emotional, the mental, the physical support to the mother during that period. So that is so important. I'm glad you brought that up. There's other reproductive journeys you can take. All of them doesn't lead to having a baby sometimes, right? So there's miscarriages, a miscarriage doula, abortion doulas, and adoption doulas.
Wow, didn't know that adoption doula. Wow.
Yeah, so you have adoption doulas, and then you have the full spectrum doulas who will work with you from the time that you conceive all the way up to postpartum, up to 3 months afterwards. So that doula is not like she's not a therapist or anything, but they provide you with the support that you need physically, mentally, and emotionally, and help to empower you throughout your journey to learn how to speak for yourself, how to advocate for yourself, to know like I need help and to say it, right? So that mental health piece is so critical, especially during pregnancy. There's a lot of women who face depression and anxiety during pregnancy too. So making sure that we're looking at all aspects of mental health and understand that everyone's reproductive journey does not end in a baby, which I think is so key to what you said. So it's important, and it's important to have doulas. So what we're trying to do in Black Mothers in Power is increase the number of doulas in the state of Delaware. So our idea is to have a doula training program. We'll train 15 individuals who will become trained and certified, and they'll be able to service women in the community and give them the services that they need.
And you just received good news on that, right?
Yes, I received good news on that. So I'm excited. I'm excited for that. So we'll see where that goes, but I'm excited for that. So some good things should be coming for 2021. So I don't want to throw everything out there. Every good thing should be coming for 2021, and hopefully that comes to fruition, and we can make sure we get a doula training program where every year we're training women to be, or even there's some men doulas. So we're training individuals to be doulas to service other people. The doulas are beneficial because they increase breastfeeding rates, especially for Black and brown communities. Increase breastfeeding rates, they lower C-sections. Black women are more likely to get C-sections than white women. And all of the C-sections, sometimes women don't even know why they're getting cut. There are some doctors who will cut you to rush a birth because they have something to do.
Wow.
Or they're tired and they're ready to go. Not saying that's all of them, but that has happened in certain instances to where Black women are having higher rates of C-sections. It's not all medical. Sometimes you don't even know why you had a C-section. Like, why did you have a C-section? I don't know. They just said I need to get cut. Like, do you know why? Like, did they explain to you what was going on, right? So it's important to have that doula so that you're asking these questions, you're advocating for yourself, and you understand what's happening with your body.
Where should people look for a doula? How do people get access to one? And is it something that adds on to the cost of the journey of pregnancy already in itself? And how do people work through that?
Yes, so doulas, there are fees. A lot of them work for free as of right now. A lot of them are because they want to service the community. They want to help their community. So a lot of them are doing it at very low rate or for free, but there is a charge to have a doula. So one of the legislations we want to, 2020 is over, but 2021, when hopefully COVID doesn't affect the General Assembly, but in 2021 get legislation that Medicaid has to cover doula services so that women who are on Medicaid can get a doula.
Mm-hmm.
And that we also want to talk to private insurance about doula reimbursement services also because we focus on Medicaid all the time because most people who are low income or who qualify get those services. But we have to remember Black women who are doctors, Black women who are lawyers, who are in the corporations, who are professionals are dying too. So I want to make sure private insurances allow for those women to also have access to doula services. So it's key. So doulas, yeah, it's an extra fee, but we're trying to work around that through legislation and working with different organizations and entities to kind of cover the cost.
Mm-hmm. One of the things that I noted when looking through your organization, you guys said that you seek to understand the intersectionality of being a Black woman by examining maternal health care for Black women who identify with the following groups: disabled, mentally ill, immigrant, homelessness, HIV/AIDS, domestic violence victim, LGBTQ, incarcerated teen mother, and addiction. Talk to me about some of those groups and how you have worked to kind of help each of them and why it's so specific. Why are those groups so specific to service?
Right. Well, if people want to add the group, we open to add it. So those are the things that I thought of like offhand, and I thought intersectionality was key to the conversation I was having because I feel like a lot of times we talk about being Black women, but we're very diverse in regards to citizen status, in regards to how we identify sexually. What are we battling? Are we battling with addiction or HIV/AIDS? So these are things that I thought of Black women who I came across who there was no maternal data, like statistics, research at all to like help this group of people, like none, not at all, to understand what was going on. So I thought it was key in understanding and making sure that Black mothers empower, that we're always centering the most unthought of, uncentered group of Black women.
Mm-hmm.
Right? How do we make sure that we're catering and all of our services are catering to the needs of the most unthought of groups of Black women? I think a lot of times, like Black women who are transgender are left out of the conversation about how they birth, how they breastfeed, which they call chest feeding. So I think it's important that we're inclusive of our language, we're inclusive of the research that we do, and we're inclusive of how every single Black woman participates in decision making and organizing and mobilizing and doing this type of work. So it was just key to me, like we have to make sure all Black women are included, like no matter what. I don't want anyone to feel left out as Black women, that their voice cannot be heard in a movement. Like, no, this is a place where you can be heard, and we will center you and give you that power that you need to be able to be an advocate for yourself.
How has the community received everything that your organization has been doing? Have people been as supportive as you would like, or do you think that it's still building and getting information and awareness out there?
Yes, the response has been actually overwhelming, too much. Like it has been a lot that I wasn't even able to handle. It was like, I've just started the issue campaign. I'm passionate about this. And as I start having conversations, emails, calls, people wanting to connect, like, how can I help? And I'm like, I don't know. Like, I don't even know. Like, I just started the issue campaign. I didn't think of it bigger than what I was thinking of it to be. So really what I'm working on now is becoming like a 501c3, getting a website created to become a little bit more organized and official so that I can gear people towards the right way to be able to become involved, to be able to get involved in this work. So that's like Black Mothers in Power. We have been getting support from the community, from hospital level, from different organizations and entities, like, hey, we know this is an issue. We want to help out. What can we do? We have every like Black men, like, yo, how can we be supportive of our Black women, right? And then you have white people who are like, how can we be in support of Black women? How can we help? So we're like trying to navigate that with each group to see how they can participate and make sure they have a proper role in this movement.
Takes me right to the Building People Power campaign. Talk to me about being a part of that and kind of how you spread that message of even if you're not Black and you don't face particularly Black issues, how people can still be involved in this advocacy work.
Yes. So the Urban League and Network Delaware did extensive research throughout the state of Delaware, focusing on specific topics amongst Black and Brown people in Delaware. So they looked at like crime, they looked at housing, they looked at healthcare, and they had a team for each one, developed this research. And based off of that research, they came up with what the solution may be to improve the lives of Black and Brown people in the state of Delaware. So if you want to get involved, I could send the information for the Building People Power, but there are like issue campaigns on housing, like what does it look like for everyone to have affordable and safe housing? Crime, what does it look like to not have a criminal justice system that is focused on imprisoning Black and Brown people at high rates, right? So these conversations are happening and you can get involved in any specific area. And even if like Black Mothers in Power is focused on Black women in particular, I think anyone could still be involved in some way. And I say that because when you center the most unthought of groups, the benefits of when a policy passed, it affects everyone, not just that group, right? So if Medicaid gets passed, that helps everyone who's on Medicaid, not just Black women on Medicaid, right? So even as non-Black people or non-women, you can get involved in each campaign. You can get involved with any campaign focused on anyone. Just know, bring your strength, be willing to learn and grow and understand, and you can always make a difference that way. But I can send the information and maybe Indy can share.
Yeah, definitely. With this I keep wanting to say organization, but right now it is a campaign that is leading in the direction of a organization. And so far, you guys have facilitated a lot of conversations that people can be a part of. But is there anything that's coming up that people should be aware of? And again, that they can kind of join in and learn more about that you guys have coming up next?
Yeah, so what's coming up next? Really just we're planning for 2021, so we have not solidified exactly what's coming up next, but we have some workshops, we have some programs that are going to be starting and hoping to be done with the whole 501c3 process and the website building soon. So hopefully soon I can come back on probably January, February and give
Great.
more of a clear answer on exactly what our next steps are. But we have a few big projects that we're working on and a few different grants we apply to. So we're just waiting for like a solid answer to be able like, this is what we're doing, this is how we're doing it, and this is what we need. So really right now we are in the building stage. So we're trying to go back and rebuild our brand, rebuild who we are and where we stand in the community.
I appreciate you being willing to come on and just spread awareness. I think that was the most important thing that I kind of wanted to get across today, just to get a little bit more people aware of what's happening, learning about those statistics, learning about doulas and all of the different things that you noted. Talk to me about how people can keep up as you are rebranding,
Right.
you are putting out more information. How can people keep up with you?
Yes, follow us on social media. So we're on Instagram, Twitter, and Facebook. If you want to shoot me an email, our email is blackmothersempower@gmail.com. And you can also join our email list. I can send that information too for people to join our email list. And you will get up-to-date emails probably once a month on what we're doing and what supports that you can bring to the table.
All righty. Thank you so much, Ms. Shané Darby. I truly appreciate you coming on the show, and I will see you soon.
Yes, thank you. And I really, really appreciate the opportunity.
Most definitely. And thank you to all of you for watching. But that's not it. Make sure that you stay tuned because we have another episode coming up next.